Hello. Today we're going to be discussing the radiographic positioning and techniques for lower extremities of the body, as well as the technical factors that are used in each position. I will be showing you individual videos of how I position a patient, what technical factors I use, and the overall process of taking the x-ray. So, hope you enjoyed the video. So for the AB ankle, our patient is going to be either supine or seated on the table with their leg extended. You want to make sure that they're in a true AP position and make sure that their foot is flexed up. Our central ray is going to be perpendicular to midway between the malleoli. We're going to be using an SID of 40 inches and a 10 by 12 cassette. For the AP Mortis, our patient is going to be supine or seated on the table. You want to make sure that they rotate their foot internally to a 15 to 20 degrees so that the intermalleolar line is parallel to the tabletop. And your central ray is going to be perpendicular midway between the malleoli, right about here. It's going to be taking at a 40 SID, and we will be using a 10 by 12 cassette. For the AP oblique of the ankle, our patient is going to be supine or seated with their leg extended. You want them to rotate their leg and foot at a 45-degree medially, and the CR is going to be perpendicular to midway between the malleoli. So it's going to be somewhere right around here. Perfect. You see, those are where your malleoli are. The exposure is going to be taken at 40 inches SID. For the lateral ankle, our patient's going to be recumbent with the affected side down. You want to make sure that their foot is dorsiflexed. That's only if the patient can tolerate it. We're going to be using a 10 by 12 cassette. You want to make sure that they're in a true lateral and that you can actually see the medial malleolus, because your CR is actually going to be perpendicular to the medial malleolus, right about here. Make sure it's at a 90 degree. Medial malleolus. You're going to be using a 40-inch SID and a 10 by 12 cassette.